and today's video is proudly sponsored by June's Journey. June's Journey is a hidden object mystery game that's set in the 1920s. And if you are a mystery crime fan like myself, or if you're just someone who needs something relaxing at the end of the day, this is the perfect game for you. June's Journey, we play as June Parker, who is an amateur detective who just moved to London. And through some suspicious circumstances, June now has to solve crimes and mysteries through investigation that naturally will have to be solved through hidden object scenes. I'm going to show you some of these scenes now. These scenes are absolutely gorgeous, and there are so many chapters of this plot you can explore and expand through to have some relaxing fun, see some beautiful scenes, and find some hidden objects while also solving some crimes. The story of this game is super intriguing, especially because we're exploring in the roaring 20s with a very dynamic storyline and a diverse cast of characters. How I like to enjoy June's Journey is, especially right before bedtime, get in bed, play June's Journey, and see some beautiful scenes, find some hidden objects, and relax and unwind. So what are you waiting for? Download June's Journey for free by clicking the link below in the description box. June's Journey is available on Android and iOS mobile devices, and as well on PC through Facebook Games. Thank you so much to June's Journey, and have an amazing rest of your night. Perfect. So it does look like we have one more patient for the evening. Let's see if they are going to arrive shortly. And perfect timing. Hello there. Welcome to Dream City Clinic. I am Dr. Brain. Are you here for the very slow, detailed cranial nerve exam, a classic examination, or are you here for the very fast and multiple medical exams, such as a cranial nerve exam, a chiropractor, an ENT, a nurse, a lice examination, and ear and nose examination? Perfect, so you're there for that one. And may I please get your name? Beautiful. Now do you spell your last name and birthday? Perfect. So you have the very fast examinations. Okay, and how much time do you have? Not much at all, it seems. Perfect timing. So take a seat. We'll get the first doctor out as soon as possible. Does that sound good with you? Perfect. Just take a seat and relax. Cheers. And perfect timing. Hello there. I'm the first of all of the medical exams for today. I am Nurse Lou, and we're going to give you just a quick nurse exam. Is that okay with you? Perfect. So first thing that I'm going to do is I'm actually going to get your temperature, if that's okay with you. Good. I want you to sit still. Okay, 3, 2, 1. Perfect. One more time. 3, 2, 1. Sit still. Perfect. And then I'm going to quickly ask you, have you had any signs of being a bit unwell? Perhaps you've been sleeping a lot lately or not sleeping enough. Okay. And have you had any fever or cold in the past 2 weeks? No, you're good. Perfect. So what I'm going to ask you to do next, we're going to get your oxygen level. Can you give me one of your fingers? Perfect. I'm going to hold it onto your finger for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Let's read the results. Looks like your oxygen level is at a 98%. That's perfect. Great. Now I'm going to ask you, I'm going to place this right on your shoulders. Is that okay with you? I'm just going to get your temperature, and it's going to be a bit of cold, okay? Good. I'm going to ask you to sit still and just breathe in and breathe out. Good. I'm going to just place this right here and here, okay? Good. So first, just breathe in. Good. I heard your stomach there. Good, and breathe out. Other side. A little cold again. Breathe in. Good. And breathe out. Very good. Gonna check your back now. Okay, breathe in. Good, and breathe out. Okay, looks like so far your medical results are looking perfect. I'm gonna have the other doctor see you, and you're gonna get an eye exam next, okay? Perfect. Cheers then. And hello there, I am Dr. I, and today we're just giving you a quick eye exam, okay? Do you wear glasses or contacts? Okay, I'm gonna ask you first, can you stare into the light for me? Look at the light, look at the light, look at the light. Very good. Other side. Look at the light, look at the light, look at the light. Very good. Have you had any problems with your eyes in the past 2 weeks? Okay, and what would you say is your easiest for you to see? Are you able to see things up close easier, or are you able to see things far away easier? Perfect. Do you feel like you have any need for glasses at all recently? No? Okay. I'm gonna ask you, can you follow the light for me? Carefully follow the light with just your eyes. I'm gonna hold your chin. Follow the light with just your eyes. Good. Great. Okay, that sounds great. So I'm gonna show you a little chart here now, and this is called a Snellen's test. I'm going to point to this first line. Can you read this letter for me? What does it say? It says E. Perfect. Okay, I'm gonna ask you to read the second line for me. What does that say? That says L. And what does the other one say? That says T. Perfect. Okay. And can you read this third line for me? It says what? F. Okay, what's the next one say? It says P. Okay, what's the next one say? It says H. Okay. I'm gonna ask you to look below. Can you see what this color is? Can dynamic lenses here, and they're going to be different visions, okay? Let me know which looks better. This is lens 1. This is lens 1. Let me know which is better. This is lens 1. And this is lens 2. Which one's better, 1 or 2? This is 1 and this is 2. This is 1 and this is 2. Which one's better, 1 or 2? 2. Perfect. I'm going to ask you one more time now. Which one's better, lens 1 or lens 2? I'm going to show you lens 1 first. This is lens 1. This is lens 1. And which is better, lens 2? This is lens 2. This is lens 2. Which one's better, 1 or 2? 1 or 2? 1 or 2? 2. Perfect. So it looks like your prescription is the same as last time. I'm going to actually have another doctor check in and see on you, but this is perfect for your eyes. Your eyes are 20/20. I'll see you for the next exam. Cheers. And hello there. I am Dr. Ear, and today I'm going to be giving you an ear, nose, and throat exam. Do you know what that is? Perfect. So I am the ENT. Your ear, nose, and your throat all work together because you have sinuses that connect them. So what I'm going to be doing is I'm going to be testing a little bit of your hearing, and then I'm going to be just taking a look at your throat and nose and checking your lymph nodes, okay? So this is what a good ear looks like on the inside, and I'm going to take a look and see. First I'm going to ask you, can I feel your lymph nodes? I'm just going to feel right here just a little bit. Okay, now I'm going to put my hands on your ears. Let me know if you can hear that, okay? And can you hear that? Perfect. So what I have here is I have something called tuning forks. I'm going to ask if you can hear these, okay? I'm going to first test this one over here, which actually creates the lowest sound. Let me know if you can hear this. Can you hear that? Good. Let's test the next one. The sound should be slightly more of a higher pitch. Can you hear that? One more time. Can you hear that? Perfect. Next, what I'm going to do is take a quick look inside your ear. What I have here is an otoscope. I'm going to take a look inside your ears and your nose. So just relax. Tell me if you can hear this. Can you hear that? Good. I'm going to take a photo here. 3, 2, 1. Good. Let's test the other ear. Let me know if you can hear this. Can you hear that? Good. Let's take a photo in 3, 2, 1. Okay, I'm going to replace the top. I'm going to take a look in your nose. 3, 2, 1. Other side. 3, 2, 1. Okay, I'm going to ask you to say ah for me. Just say ah. And what I'm going to do is I'm going to take a photo in 3, 2, 1. And one more. 3, 2, 1. And relax. Perfect. So it looks like your ear, nose, and throat are looking good to me. Looks like you're not having any allergies, are you? Good. You also have no signs of irritation, which is perfect for me. Thank you so much for letting me come on by. I'm going to get the next doctor to come and see you. Okay, cheers. And hello there, I'm the school nurse. I am Nurse Joy, and today we're just going to be giving you a quick scalp and lice check. Is that okay with you? Good, I'm just going to ask you to sit still because this is going to be a very thorough but yet fast exam, so you don't sit here for long. Okay, can I brush through your hair? Good, let me know if you can feel that. Good. Okay, let's take a look here. I got my little brush. I'm gonna just perfect, and then just brush that again. Now let's take one more look. Perfect. And what I'm going to do now is I'm going to apply a little bit of ointment right onto the scalp to make sure that we're going to keep your scalp clean. Okay, just going to. Perfect. And then one more look. Let's see. Okay, and then one more brush through. Perfect. It looks to me that your scalp is looking good. There's no lice there, so I'm going to have the next medical professional come and see you, okay? Perfect. Cheers. Now just stay happy out there. Okay, and hello there. I'm Dr. 2. Today we're going to be giving you just a dentistry exam. As I am the dentist of the evening, we're going to be using some of our tools here. First, going to ask you, can you just say ah for me? Say ah. Perfect. Have you had any problems with your teeth at all? Perhaps any of your tonsils? No. Okay, just relax. Now, have you been brushing your teeth every day? What about flossing? How many times a day? Okay, well, we'll see if that is true. Can you just say ah? Perfect, just say ah. I'm just going to take a look here. so I'm gonna let you go now. It looks like your teeth are working in proper formation. It also looks like you're flossing and brushing your teeth quite regularly. I would increase the flossing though, because I can tell. Thank you so much for coming on by to the dentist's office. I'm going to have another doctor to send in and talk to you soon. Cheers. And hello there, I'm Dr. Bones. I'm the chiropractor, and I was taking a look just at your x-rays here, and it looks like we need to adjust some of your musculature system to make sure that you're functioning at 100%. Does that sound good with you? Perfect. So is it okay if I just put some pressure on your shoulders here? Okay, I'm just gonna first feel. And can you feel that? Good. I'm gonna ask you, can you raise your shoulders? And I want you to resist me pushing down on them, okay? So first resist, 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 resist. Good. Now relax. Can you put your hand up for me? Good. And can you put your other hand up for me? Good. Now I'm just going to move around your musculature to make sure that we can get everything to work. Okay. This will not feel a thing. Get ready in 3, 2, 1. Good. And let's just over here. 3, 2, 1. And we're gonna adjust right over here at 3, 2, 1. Okay. And can you just move your muscles around for me one more time? Okay. Now I'm gonna adjust right on this shoulder line. 3, 2, 1. Okay, and over here right at the center. 3, 2, 1. Okay, and now I'm gonna ask you, can you raise your shoulders one more time? Does that feel more comfortable for you? I'm gonna just move right onto your back one more time, because it looks like your right side's compensating for your left, so we gotta fix that. 3, 2, 1. Okay, and over here. 3, 2, 1. Perfect. Now can you move your shoulders for me? Good. And can you move your hands around? Perfect. It looks like your musculature is now working at 100% how it's supposed to be with your musculature and your bone system. Thank you so much for coming on by. I'll have the next medical professional send them on in. Okay, perfect. Cheers, love. And hello there, I'm Dr. Focus. Today I'm going to be asking you to follow a focus exam for me. So I'm going to ask you to do exactly as I say. Just focus and follow exactly what I say. Do as I say. Perfect. Let's begin. I'm going to ask you just to follow the light with just your eyes. Don't move your head or your neck, just with your eyes, okay? Now focus, follow the light. Good. It's going to be a bit more fast than usual. Okay, good. Now just with your face. Do not move any other part of your face. Just look with your eyes, okay? And what side am I asking you to focus on now? Is this your left or your right? Good. And what about now? Is this your left or your right? Very good. Okay, I'm going to ask you to take a look at these lights for me, okay? Take a look at the lights right there. Can you see that for me? Good. Take a look. And what colors are you seeing the most? Perfect. You're seeing green and red. Perfect. Now I'm going to ask you to look over here. I have these two water orbs is what I like to call them. I want you to focus on one or the other. Only focus on the right one or the left one. So just focus on it, keep looking at it, focus on it, keep looking at it, focus on it, keep looking at it. Okay, which one did you choose, left or right? Let me know. Which one did you choose, left or right? Let me know. Keep focus, keep focus, keep focus, keep focus, keep focus. Now look at the other one, look at the other one. If you looked at the right one, look at the left one. If you look at the left one, look at the right one. Okay, now just keep focus, keep looking, keep focus, keep looking, keep focus, keep looking, keep focus, and keep looking. Very good. Are you focusing? Are you looking? Okay, carefully let me know right now. How many fingers am I holding up? This is 5. Perfect. How many fingers am I holding up now? This is 4. Perfect. How many fingers am I holding up now? That's 3. Perfect. How about now? How many fingers am I holding up? Perfect. That is 1. And how many fingers am I holding up now? That's 2. Perfect. What I'm going to ask you to do is, again, look back at the light. Can you look over here? Good. And can you look over here? Can you look in the center? Okay. And can you tell me what day is it today? Perfect. And what time is it right now as we speak? Perfect. Let me know. Good. And can you tell me the last food that you ate? Tell me the last food that you ate. What was it? Perfect. So it looks like your focus is doing well. I'm going to send the last doctor in to come and examine you. Thank you so much for coming on by, and I'll see you very soon. And hello there. I am the final doctor of the day. I am Dr. Ear. Today I'm going to be testing your hearing and cleaning your ears. Is that okay with you? Perfect. So first I'm going to take a quick look inside your ear with an otoscope, okay? Let me just take a look. Okay, it looks like your ears are relatively clean. A little bit of whack. That's normal with your ear. Good. So what I'm going to do first is going to give you a beep because I'm going to put these headphones on, and I have a tool here that makes a couple of sounds. I just want you to let me know when you hear a beep by raising your hand, okay? Let's begin. Okay, perfect. So it looks like you hear all the beeps. I'm just going to carefully clean your ears. A little bit of ear cleansing solution. I'm just going to carefully tilt your head. I'm going to add a couple of drops. Relax. 1, 2, 3. Okay, good. And tilt your head the other direction now. system's going to clear. Perfect, your ear is so clean.